Welcome to the ActiveCare DVT Intermittent Pneumatic Compression System. Today we'll be talking about the indications and contraindications for ActiveCare DVT, as well as showing you how to set up and operate the device, position the various sleeves, and discontinue treatment. Let's begin with a general overview of the product. The ActiveCare DVT system applies sequential compression to the lower extremities through thigh, calf, or foot sleeves. These sleeves are available in a variety of sizes and can be used in any configuration to suit your patient's needs. The ActiveCare DVT unit is both miniature and mobile with battery backup. This allows patients to continue thromboprophylaxis during ambulation or transfer without requiring intervention from the caregiver. Before using the ActiveCare DVT system, make certain that you read the user manual and have a thorough understanding of the technical principles and clinical applications associated with the device. The ActiveCare DVT system is a prescription device intended for use in preventing deep vein thrombus, DVT, enhancing blood circulation, diminishing postoperative pain and swelling, reducing wound healing time, and reducing edema. The ActiveCare DVT system should not be used in patients who exhibit acute pre-existing DVT, pulmonary embolism, PE, leg gangrene, recent skin graft, acute thrombophlebitis, or in situations where increased venous and lymphatic return would be detrimental. Before we talk about setup and operation, it's important to point out a few precautions associated with the use of this device. Inspect the legs of patients using the device at least once a day for skin changes. If your patient has loss of or impaired sensation in their legs prior to wearing the device, double-check the positioning and proper adjustment of the sleeve before and during operation. If the calf sleeve is positioned upside down, your patient may experience discomfort, injury, and/or their foot may swell. Always ensure proper placement of the sleeve. To set up the ActiveCare DVT system, first connect the transformer to the DC power supply jack on the back of the device. Making sure that the transformer you are using has the appropriate plug for your electrical supply, connect it to the main power supply so that the rechargeable batteries can be charged. Assemble the desired combination of 1 or 2 sleeves and 1 or 2 lengths of extension tubing. Sleeves can be used in any combination while being controlled by a single device. Acceptable sleeve combinations are listed in the user manual. Examine the sleeve and reusable connecting tubing to make sure that they are not cracked or damaged in any way. This product demonstration uses the short extension tubes. Longer tubing is available for operating room use. It is critical both to select the correct sleeve size and to position the sleeve properly so that patients receive optimal benefit from the device. Loosely fastened sleeves can be ineffective, while sleeves that are too tight can be uncomfortable for the patient. We recommend positioning the sleeves over cotton stockings to enhance patient comfort. Make sure that the smooth side of the sleeve is next to the leg, and the tubes and fasteners are located on the outside of the sleeve. The patient's leg is placed on top of the open sleeve with the ankle arrow pointing down toward the patient's ankle and the word thigh at the patient's thigh. Fasten the sleeve using the self-fastening material. First, secure the tabs below the patient's knee. Next, fasten those above the knee. And finally, connect the tabs around the patient's ankle. Be sure to leave enough room to insert 2 fingers between the leg and sleeve. Again, ensure that the smooth side of the sleeve is touching the leg and the tubes and fasteners are on the outside of the sleeve. With the patient's leg on top of the open sleeve, make sure that the ankle arrow is pointing down toward the patient's ankle and the knee arrow is pointing up toward the knee. Fasten the sleeve using the self-fastening material. First, secure the tabs immediately below the patient's knee. Fasten the middle tabs next. And lastly, connect the tabs around the patient's ankle. Remember to leave enough room to insert 2 fingers between the leg and sleeve. Make certain that the smooth side of the sleeve is next to the patient's foot, with the tubes and fasteners located on the outside of the sleeve. Place the foot on the open sleeve with the heel positioned at the end with the longer tabs, and the toes at the end of the sleeve with the shorter tabs. Fasten the sleeve using the self-fastening material. Secure the tabs around the midsection of the patient's foot first. Next, connect those around the toe. And finally, bring the T-shaped fasteners from behind the heel and attach them to the tabs covering the midsection of the patient's foot. As always, allow enough room to insert 2 fingers between the foot and sleeve. Once the sleeve is properly positioned on the patient's leg, connect one end of the extension tubing to the sleeve connector with a white arrow facing up. Connect the other end of the extension tubing to the device, also with a white arrow face up. An audible click will be heard when the connector is seated correctly. Note that on the calf and thigh sleeves, the white arrows should be aligned with the connectors. Since the extension tubing is permanently connected to the foot sleeve, simply connect the end of the tubing to the device with the white arrow facing up. Again, you will hear a click when the tubing connector is properly seated. Switch on the ActiveCare DVT unit's on-off control located on the back of the device to trigger the self-test mode. Both the power on and error indicators will flash, and the audio alarm will beep 3 times. The unit will then begin self-diagnostics. If any problems are detected, an alarm will sound. Refer to the troubleshooting section of the user manual to assist you in correcting alarm conditions. Following the self-test mode, the ActiveCare DVT unit will automatically identify the specific sleeves that are being used and select the correct mode of operation. This may take up to 2 minutes. The operation mode light will illuminate below the appropriate program icon. If only one sleeve is used, this light will blink. During the first cycle, carefully monitor at least one complete inflation-deflation sequence on each leg, checking to make sure that the cells are inflating and deflating in the correct sequence from distal to proximal. You should still be able to place 1 finger between the sleeve and the patient's leg during the inflation phase of the cycle. Finally, check to make certain that the correct operation mode is indicated. To change the mode of operation, simply switch off the control, connect the appropriate sleeve, and switch the device back on. Whenever possible, or if the low battery light is on, connect the device to the main power supply through the transformer so that the batteries can charge. A fully charged battery will last for approximately 4 hours. For detailed information about battery operation, consult your user manual. The carrying strap for the ActiveCare DVT unit is designed to be used in a variety of ways. It can be configured for over-the-shoulder use during ambulation or attached to a bed, bedside chair, walker, or wheelchair. The strap can easily be converted from a short length to hang on a bed rail to a long length for over-the-shoulder use. When your patient is wearing the ActiveCare DVT system while walking, the extension tubing should be shortened to prevent tripping. Just loop the tubing through the clips on either side of the device, like this. Proper placement of the straps when patients are ambulating is very important. They should be placed around the shoulder and under one arm. The device should never be worn around the neck, hanging loose in front of the body. For use on a bed or walker, straps can be shortened and wrapped around the rail. When you are ready to discontinue ActiveCare DVT system treatment, simply switch the control to the off position, disconnect the sleeve connectors from the device, and remove the sleeves from the patient. Remove the extension tubing from the device and sleeves, or from the device alone if you are using foot sleeves. Please clean and store the device according to your facility's policy. Proper cleaning procedure is outlined in the user manual. Sleeves should be disposed of after 1 patient or 1 week's use, according to national regulations regarding non-toxic plastic waste discharge. The ActiveCare DVT is the first lightweight, fully automatic, sequential compression therapy device with battery backup. Its improved compliance provides maximum DVT prevention for your patients during every phase of their care path. We hope this brief overview of the ActiveCare DVT system has been helpful. You can find additional detailed information about the product in the ActiveCare DVT System User Manual. Thanks for watching.